Yo, what is going on? Dentists hate these types of cases, and I'll explain to you why. My name is Akramo, and I'm a dentist. This is going to be a case review, part of series that I'm going to upload. First of all, this young lady has beautiful smile and beautiful lips that match with the smile. The problem is, as you can see, we have huge dental cavity on a bunch of her front teeth. In fact, on a central incisor, right, which is that upper front tooth, upper central incisor, and on a lateral incisor. You may be saying, dentist bro, like, don't get on with all of that medical jargon. It just means on these upper two teeth. Now, she does have some plaque stains, but today I'm gonna focus on these two cavities. This is gonna be real quick. So why do they hate them? The cavity itself, the dental decay there, it's actually relatively easy to access and clean. Now, where the complications arise is, let's say, when it comes to the choice of the filling for a case like this, I personally would go for dental composite, for example. Now, there are other materials, and for these things, dental composite is this tooth colored or tooth-like colored filling material, the aesthetic filling material. There are other options that can be used. Maybe I'll elaborate on this on different videos. Now, the problem with dental composites is that they're very sensitive to something called as moisture. That's why you may have seen a rubber dam like this rubber sheet being used to help isolate the teeth during a dental composite procedure, a dental filling like dental composite procedure. So what does moisture have anything to do with this area? Because these cavities, they are very close to the gums. They're very close to the gum line. They're very close to the gingiva, right? And any event like the slightest hit to the gingiva, if that drill or the high speed the dentist uses, may lead to that gingiva bleed. And in fact, a lot of these cavities may extend quite deeper down. Like they may look like this, but when the dentist actually comes to clean them, they may be slightly deeper down vertically and also deeper in a 3D dimension, like deeper in depth. As well. So same thing for this one. So they're actually somewhat relatively easy to access and treat. The problem is really depends on the extent of them, on the gums and the gum health. Here the gums don't really look damaged that much, but there are things that we may use like a gingiva retractor, or gingiva retraction cords, excuse me, so which are simply cords that help push the gum away for us to see better and work better. Now, how far this cavity extends vertically will also affect perhaps the treatment plan. Okay, so if you see something like this, see the dentist as soon as possible. Quick case review with Dr. Mo Dentist.
Don't forget to like and subscribe to Dr. Mo.